this year is just going by so quickly. And I'm Laura Maloof Miller, Program Manager here in the Wellness Department, along with Kristen Kayla. We always review just a few of the housekeeping items. Everybody's muted, of course, to avoid any of the background noise. At the end of the webinar, as you exit, there'll be an anonymous, really short survey. So your feedback, of course, is always appreciated. And you can text directly to Kristen today by using the chat function. So if you have any questions throughout the webinar, please just chat to her. And then everybody who registered for the webinar, whether they were able to join today or not, will receive a link to this recording. Just to give her a couple of days to do that. And today's presentation, so this is really focused in on whole person wellness. We're going to take a look at how the powerful connection we have between our emotional resilience, heart health, and our inner purpose. Oh, just remember, please, that the information provided in this presentation is intended solely for the general information of the audience. It's not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. So today, because February is Heart Health Month, we're really going to take a look at how heart health fits into the bigger picture of whole person well-being, which actually goes far beyond just our physical health. True well-being is really about nurturing all the dimensions of who we are. And so I was going to start out with really trying to understand the difference between the terms wellness and well-being. From there, I'm going to dive into heart health, including strategies for chronic disease prevention and that really powerful link between emotional resilience and our cardiovascular health. And at the end, I'm going to explore how our purpose affects our overall health and well-being, followed by some realistic goal-setting strategies that help you to support your whole person well-being, helps you to nurture the balance across mind, body, and spirit. So let's dive in. Wellness, the term refers to a single aspect of our health, such as physical, emotional, financial wellness. Often we do sort of targeted programs or challenges. Like, for instance, maybe you're doing a step challenge. So that's, for physical health. Or well-being, on the other hand, is really more of a holistic approach. So it looks at the whole person and how they're interconnected with the different dimensions, as you see on the slide here: physical, emotional, social, clinical, financial factors. It also may include environmental and occupational areas as well, or dimensions. So each of these areas of wellness by itself, this contributes to or is a part of our total well-being. When we start to talk about heart disease or heart health, every year in the United States, someone has a heart attack about every 40 seconds. That is super scary. But there are things that, of course, we can do to try and prevent a heart attack and to lower our risk of coronary heart disease. The first place is to start with, well, what are our risk factors? And so you may already be familiar with some of them. It's things like smoking, use of alcohol, being overweight, not getting enough exercise, having high blood pressure already, too much of the bad cholesterol, and having diabetes. So our risk does grow as we age, and also if we have a family history of heart disease. Now, many of these factors we do have some control over, unlike our age and our family history. Also, if you have any of these risk factors already, you want to make sure that you're checking in with your doctor. You, of course, want to be proactive when it comes to our heart health. Nutrition. What about the foods that we eat? Well, the Mediterranean diet is known as a heart healthy diet. It consists of plant-based foods, lean proteins, also healthy fats. Now, this eating style has been linked to the lowering our risk of heart disease, heart attack, stroke, lowering our blood pressure, lowering high cholesterol, helps with obesity and also with diabetes. When we think of this eating pattern, think of whole foods. So imagine fruits, vegetables, whole grains, nuts, beans, and also healthy fats like olive oil. You want to eat from the rainbow. When you look at your plate, it should have colorful fruits and vegetables. You should think of, healthy fats. Think of fish. Nuts and nut butters are included in this healthy diet, but those can be high in fat, although the good fat. So you just kind of want to watch the portion of those. Also, you may already be familiar with the general exercise guideline of 30 minutes of activity like walking, most days of the week. And now sitting is becoming just as bad as smoking. And often we sit really for long periods of time. We also want to include or incorporate strength training exercises a few times a week. So you want to build those muscles up as well as doing cardiovascular or aerobic exercise. Sleep is another one. Do you know how much sleep affects our heart health? Not only is it good for our general health and, of course, productivity to sleep well, but it actually plays a significant role in our metabolism. It turns out that folks that are sleep deprived are hungrier. Well, what do they crave? They're going to crave high carb, high fat, and those sugary foods. So, of course, this can contribute to poor diet and weight gain. Our hormones are also impacted by how much sleep we get. So research has shown that inconsistent sleeping patterns put us at risk for obesity, high cholesterol, high blood pressure, and high blood sugar as well. So if you'd like to chat us, you're welcome to chat. You don't have to do it, but if you would like to, what are you doing today to protect your heart? Now, when you do use the chat function in order to protect your privacy, the chats are only coming to Kristen. They're not going to be shared out with the group. So, Kristen, if you want to read a few that come in, but what kinds of things are you doing today that are protecting your heart?
All right, Laura, I see daily walking, taking a brisk morning walk. Some are walking for 2 miles or walking after meals. Also exercising and eating well. Here's a good one. It's getting enough sleep at night. Watching their diet, eating a vegetarian diet. Someone's also eating a high fiber diet. Oh, eating all the colors of the rainbow. That's a really good one.
Nice.
Mm-hmm. Doctor
Great.
visits to assess heart health due to family history. Mm-hmm. Yeah.
Okay, great. Well, thank you so much for sharing that information.
Sure.
So, in addition to healthy eating, exercise, quality sleep, what else can we do to protect our heart? Well, many of us can't just up and quit our day job, but it turns out that working those really long hours is associated with increased risk of heart disease and stroke. And of course, it makes sense. We're at our desk, we're sitting for long periods of time. of course you're going to be less active. But, these long hours, these long work hours do expose us to more mental and physical hazards like, stress due to the high demands and less preventative care. After all, who has time to go visit the doctor? If you love what you do and it comes with long hours, that's actually a much better scenario than someone whose job is, of course, incredibly stressful and dreads the work. Now, as you can imagine, stress affects our hormones. So we find ourselves in that fight or flight response. A little bit of stress, of course, is good. It's the problem is when it becomes chronic stress. This is, of course, over time. So really trying to find a positive work environment is key, along with the other heart healthy points that we already covered. And many of you are doing that already. Good food, sleep, and exercise. Why do many of us leave PTO or vacation time on the table? It's because we worry about falling behind or our work piling up while we're gone. And even when we're on vacation, guess what? We're reachable. But taking time off helps to relieve stress, and it's good for our heart. You should be viewing your time off as well-deserved and positive, not a guilty pleasure. And one really key important factor, we need to unplug. So don't check your work email. It's really, really important to fully check out. Now, heart disease often develops silently over years. So regular preventative checkups, this gives you a chance to catch problems early, reduce your risks, and maintain your long-term cardiovascular health. Like somebody had said in the chat, runs in their family, runs in my family as well. High blood pressure has no symptoms. So the only way you know what your blood pressure is to have it checked. If you have high blood pressure, the best way to control it, long-term is to consistently follow your treatment plan, which may include diet, exercise, and medication. I didn't know this. Regular flossing. It not only protects your teeth, but your heart too. There's a link between gum disease and cardiovascular disease. Now, researchers aren't exactly sure why this correlation, but it has something to do between the inflammation of gum disease related to cardiovascular health. So make sure to floss your teeth. What about happiness? Happiness is actually linked to better heart health as well. And being happy may actually lower your risk of developing cardiovascular disease, and it may help manage it if it's present. In a 2015 study, found that people with the highest optimism levels, they were 92% more likely to have ideal cardiovascular health compared to those who were the most pessimistic individuals. Now, is it possible that being happy has a direct effect on your body to promote heart health, such as better immune function, lower levels of inflammation, a lower heart rate and blood pressure? Or maybe is it that happy people tend to engage more in heart healthy behaviors, and having a positive mental outlook prevents those negative consequences of stress? We know that stress is your body's response to challenges, but it triggers hormones so that you are prepared for action. So we talk about short-term or acute stress. There's a bear chasing you in the woods, but that should go away. Chronic stress is the one that we really worry about. Now, that could be something like a long illness or a strained relationship. This is going to keep the body in that constant state of alert, and that can lead to some serious health problems. I'm not going to say that chronic stress directly causes heart attacks. It doesn't, but It contributes to conditions like anxiety and depression and high blood pressure and insomnia, which do raise your risk for heart disease. So stress also can lead to unhealthy habits like smoking or a poor diet or lack of exercise that obviously further increase your cardiovascular risk. Exercise is one of the best ways to help reduce stress and support your heart health at the same time. So, this is going to improve your physical fitness. It lowers those stress hormones and it helps your body to release endorphins. Those are the chemicals in the body that help boost your mood and relieve pain. Those are the happy chemicals, endorphins. Healthy relationships help to lower stress as well, support recovery from illness, maybe even extend our lifespan. It's just like beyond just making us feel emotionally good. The opposite effect, of course, happens with rocky relationships. That tends to increase our blood pressure and our heart rate increases as well. And there is a really strong connection between our heart and our mental health. So people with chronic illnesses like coronary heart disease, they also might be depressed. And the opposite is true as well. People with depression are likely to have other conditions too. So incorporating a lifestyle changes can help both boost your heart health and your mental health. So think of building supportive relationships, engaging in enjoyable activities, things you love to do. You may need to seek professional support if needed. Therapy can be critical in managing relationship related stress and helping to promote heart health. Now, our emotions. This is what gives life richness, meaning, and purpose. So, when we talk about resilience, that is the ability to prepare for, recover from, and adapt to stress, adversity, trauma, or challenges. So, managing emotions really is essential for maintaining our health, optimal functioning, and resilience. In Harvard, the medical school did a study. Over 1,600 heart attack survivors. Now, they found that when they became angry during emotional conflicts, their risk of another heart attack more than doubled versus those who remained calm. So, understanding and managing our emotions, not only do we protect our hearts, but it really helps us to build resilience. And that is what's needed to thrive in our everyday aspects of our lives. Stress is everywhere. Use the chat. How do you build or maintain resilience? So, when life gets you down, how do you bounce back? What tools, do you use to bounce back? Again, we're going to read just a few of the responses that come in. They are private, but interested to know, what do you do when you are stressed or life gets you down or you have a conflict or a challenge? What types of things do you do to either maintain your resilience or to build it?
Hi, Laura. I see some people, they pray, some people listen to music, take time to cry, um, family support through the good times and the bad times,
Yeah.
meditation, exercise, talk to friends, go to a dance class. And oh, this is a
Okay.
good one, going outdoors, but also reflect on the perspective. Will this matter next month, next year, or even in the next 10 years?
That's true. That is a really good one.
Hmm.
Yeah.
Breathing techniques, taking deep breaths.
Well, thank you so much for participating. Here are some ways, if we have the ability, to be resilient, to be able to bounce back, and to have sort of a overall positive attitude when we hit, life's challenges, that can really help us to lower our stress, which then, of course, helps to protect our heart and improve our mental health. So these are just a few suggestions. Breaking large problems into smaller, more manageable tasks or actions, not doing it alone, getting that support. If you're struggling, look to family, friends, coworkers, or professionals for help and support. And also remembering that self-care is not selfish. It's really critical to your well-being. So thinking of, what do you do for yourself? Is it staying hydrated? Is it eating a healthy meal? Is it movement? Is it sleep? Is it doing something that you love, like having a hobby or having healthy outlets away from work? We had somebody who said they were going outside. Absolutely. For me personally, I enjoy tap dancing. And my husband, he enjoys Toastmasters. So those are things that we do outside of work that help us to manage life's stress. Mindfulness. This really helps to keep us focused on the present moment. Instead of worrying about, hey, what's going to happen in the future, or reliving the past. I seem to have a habit of doing that, worrying about the future and reliving the past. So I need help too. Simply focusing on your breath can help relax that nervous system. Slowly breathing in and out helps to calm our nervous system. Also, being thankful each day. One thing each day. You can maybe write it down, big or small, it doesn't really matter. It just might be something like, the sun came out today. I heard a bird sing. Someone opened the door for me, or somebody gave me a smile, or I smiled at somebody. These feelings of gratitude help shift our thoughts away from worry and stress. Moving our body, of course, with a little bit of a walk or maybe a gentle stretching. This can help relax the mind as well. It has a really positive impact both on our mental and our emotional well-being. You could try a walking meditation or a grounding exercise, which can help you to feel more balanced and centered. There's something called soft gazing. This is where you simply look gently at something around you without focusing too hard on it. This helps the body relax as well. Having a purpose in life has been found to have many benefits for people, including better health, emotion management, less stress during stressful times, even economic success. It's considered a key to happiness and well-being. This is another opportunity if you'd like to chat. What? What gives you purpose? What kinds of things in your life give you purpose?
I'm seeing being able to help others, my family. Let's see. Family smile, giving and helping others. As a full-time caregiver, I make time to do something every day that I like. Having
Oh,
faith,
that's great.
yeah, having faith in God, doing things that make my family happy, like baking and spending time with them. Let's see. Helping others, that's a common one. Oh,
Yeah,
rescuing cats
great.
from the neighborhood.
Oh, that's great, Kristen. Thank you again for participating. So this is a slide on some different areas that gives us purpose. So I'm going to start at the top where the star is and move clockwise. So the very first one with the star is our family and relationships. So supporting and providing for your family and caretaking, whether we're searching for, finding, or maintaining close relationships. So somebody had included that in the chat. Also, this one, the next one with the little praying hands, that's religion and spirituality. So, living in accordance with and meeting the standards of your religious or spiritual beliefs. The third one with the little heart is service. So, that's serving your country or your community. And then the next one, what looks like they're sort of sleeping, is inner peace, being grateful for what you have and accepting what you can't change. The next one is the happy face, which is, yes, happiness, being happy, enjoying life and feeling good. The next one is positive impact. That's like the little leaf, the green one. Um, Positive impact, making the world a better place. And then the scales is that one is values. So knowing who you are and what you stand for and living your life according to these principles. The heart there is physical health. So taking care of your body and being healthy. And self-sufficiency, that's the one that looks like the little plant. Being able to take care of yourself physically, financially, and having the freedom to do as you wish. And then the little briefcase there, occupational fulfillment. So finding your calling through work, doing your job well and working hard. And the last one, the little arrow going up, is self-improvement, becoming the best that you can be. And so when we focus on what brings purpose to our life, you can actually calm the mind, support emotional balance, and enhance our overall well-being. So generally speaking, a sense of purpose is an overall idea that guides your actions, decisions, and behaviors. For many people, a sense of purpose is directed outwardly. That means helping people or leaving a benefit for the world rather than things that only benefit oneself. In a 2019 review published in the Current Cardiology Reports, this is a study, found that having a sense of purpose was linked to a lower risk of heart disease. Well, why is this? Well, having a sense of purpose does give us some protection over our mental health and against those harmful effects of stress. It also is a result of more social support, which can boost our heart health. Each person's sense of purpose, of course, is going to be based on your own life experience, your situation, your goals, and your personality. But think honestly about what you love to do. Consider where your strong skills are or your favorite activities. Determine what you want your life's legacy to be. And, take some time for self-reflection. Help you focus on your sense of purpose. Once you do that, you kind of like setting goals is often a big part of discovering and crafting our purpose in life. Remember that the benefits of having a sense of purpose, it's both for your mind and your body. So taking the time to really think about it and setting some goals, it's really worth the effort. Also, staying socially connected to other people can help you maintain your sense of purpose as well. When we talk about whole person well-being, it really becomes much more achievable, things that you want to achieve, the goals, when we set realistic, meaningful goals. So I've got the SMART framework listed here on this slide. It helps to turn our good intentions into actual actions that are going to help support mental clarity, your physical energy, and your spiritual balance. So there's a couple little examples here on this slide, little small steps that you could do for your mind, body, and spirit. With your mind, maybe it's looking at the glass is half full, not half empty. For your body, maybe it's setting time to get up from your desk at regular intervals. And for your spirit, maybe like it's meditation, or like other folks said in the chat, listening to music. These are small, consistent choices that help to build that momentum that becomes sustainable. It could be a 20-minute walk. It could be journaling a few times a week or scheduling a regular connection with someone that you care about. All of these little actions create a ripple effect toward a more healthier and a more balanced life. I wanted to take just a few minutes. There's a little exercise we're going to do. Just sit, relax, really just about noticing what's happening inside of you internally and sort of trying to reconnect what really truly supports your well-being emotionally, mentally, and socially. So you're welcome to close your eyes, whatever you'd like to do. We're just going to pause. We're just going to sit. We're just going to take 2 or 3 slow breaths. If you want to, you're welcome to place your hand on your heart or your chest. It's an optional, but it's also grounding if you do. And just think about if your heart could speak right now, what would it say it needs most? Maybe it needs rest or connection, compassion from yourself or from others. Maybe it wants clarity or encouragement. Just give yourself a moment. If your heart could speak right now, what would it say it needs most? Just listen and see what it's saying to you. And then, what's one small thing that you could do this week to honor what your heart needs? One small little thing. When we listen to the heart, we create well-being that sustains both our work and our lives. Now, as I wrap up today, I wanted to leave you with some resources. This one is more on heart health and preventative care. Of course, the American Heart Association is a really good resource as well. I listed the CDC. Depending on what health insurance you have, you'll have some preventative health guidelines, but it's always good to check and make sure you're up to date on your preventative health. If blood pressure is an issue for you and you would like to track it, this is a website which lets you have a free tool that you can track what your blood pressure numbers are. And in the area of nutrition, My Plate is a good one as well for being able to plan your meals and see what some more heart health choices in the nutritionfacts.org. And then I just listed this free app called the Daily Dozen. It's an opportunity to track some of the heart healthy foods that you are eating. And then when it comes to emotional and spiritual well-being, HeartMath, there's really a connection between our heart and also our brain. So it's a good website to take a look there. Insight Timer, this is about meditation and mindfulness. It's a free app to download as well. And then lots of really good information out of Berkeley, the Greater Good Science Center, if you're looking for information on purpose and meaning and mindfulness and stress management, can be found there as well. And these were just a few resources. I also located this one. This is a 1-month heart healthy action each day. So it's an intentional, short, 5 to 15 minute little action that you can do without feeling overwhelmed. This will be in the email that we send out tomorrow with the recording. So it's movement, nutrition, stress, sleep, prevention activities as well. Quick, easy ones that you can do here. So the idea is to try, one small thing today, keep what works, and build on, momentum over time. I appreciate your attention today. These next slides are on programs that help our Health Net members to build or maintain their healthy habits. We've got a lot of information when you log into your account on healthnet.com. The health risk assessment, it's a new year. If you have not done this yet, really great opportunity. It takes about 20 minutes or so, gives you a nice sort of a snapshot of your health status. It covers things like nutrition, exercise, emotional health, even financial well-being is in there as well. Health Nets is called the Real Age Test. So check with your health plan for similar offerings. And health coaching. Sometimes we just need some support along the way when we need to make some lifestyle improvements. You don't have to do it alone. So working with a health coach can help to keep you, on track and motivated as well. Craving to Quit. This is Health Net's tobacco cessation program, and it's really designed for folks that are ready to quit, to permanently break their addiction to tobacco. Also living in California, you have access to Kick It California. That is also a free program. Eat Right Now. This is really about healthy eating habits, not dieting. So Eat Right Now may be for you as well. It's about mindful eating, really focused in on things like triggers, cravings, building those healthy habits, and emotional eating are covered in this program. And of course, life is stressful, as we talked about today. Unwinding by Sharecare. This is actually open to everybody. You just have a different URL, but it's tools, videos, modules that are going to help you build resilience and to decrease the chronic stress. And of course, we offer discounts for our members. So if you're interested in that, HealthNet members, feel free to check that out. And we have a challenge. Well, there's lots of challenges through our wellness platform. They are open to everybody. So every month you will find challenges on stress and steps, sleep, and nutrition. Again, open to everybody. We also have every month one that is specific for HealthNet members. So coming up in March, which is National Nutrition Month, we're going to have a Healthy Plate Challenge. And then coming up in March, we have a webinar, Intuitive Eating, How to Heal Your Relationship with Food. So this webinar is going to be talking about, well, what is intuitive eating and how to incorporate healthier eating habits into your daily life. It also encompasses mindfulness techniques as well. So we hope you will join us for that one next month. And I appreciate your time today. Again, thank you for joining, and everybody who registered, whether you were able to attend the webinar or not, will receive a link to the recording in just a few days. So I thank you so much for your time. Feel free to exit the webinar.